Welcome back to the new at CSU. My name is Jasmine Dilver, and I will be giving you the 411 of campus life. As of fall 2017, sleep deprivation is at an all-time high, especially for nursing students. Breaking news! There has been an outbreak of MRSA at the CSU gymnasium. It is contagious and spreading like wildfire. Let's head back to the studio with Kirsten and Danae for more information on this contagious disease.
Thank you, Jasmine. MRSA is a methicillin-resistant strain of Staphylococcus aureus, a gram-positive bacteria that lives on the skin. In most cases, MRSA will cause a severely uncomfortable skin infection.
MRSA is spread through contact. This means you must come in contact with the individual that has MRSA in order for you to get it. It is also spread through contact with contaminated objects.
If left untreated, MRSA can cause sepsis, so if you think you've been exposed to it here on Campus, please seek treatment immediately. Some signs that you may be experiencing MRSA are redness and swelling,
pain and fever,
the area of suspicion might be warm to the touch,
or there may be drainage from the site.
Now, here's an inside look on a student that is experiencing MRSA.
Hi, I'm Danae Davis, and I'm one of the attending nurses taking care of some of the students from Coppin State University as they're experiencing the MRSA outbreak. I have a student here who has been experiencing symptoms for a few days, and she finally came in to see us to be treated for her infection. Hi, Miss Bradshaw. How are you?
Good. How are you?
Good. How are you feeling today?
I'm okay.
That's good. Can you tell us a little bit about what you were experiencing before coming to see us?
I had pain and swelling and little pimples that just wouldn't go away. I thought it was an allergic reaction, so I was taking Benadryl, but the Benadryl didn't help. Then, like the signs kind of got worse, as you see, and I decided to come to the hospital because I didn't know what else to do.
Okay. So we were able to do a culture and sensitivity test, and we were able to confirm that you do in fact have MRSA, and we understand that Coppin State University is experiencing a little bit of an outbreak. So the doctor has ordered vancomycin for you, which is the treatment of choice for MRSA, and you will be on it, and as your symptoms begin to clear up, we will be able to move forward with discharging, okay?
Okay.
All right. So, it is very important that when you are taking care of a patient that has MRSA that you wear gloves to prevent yourself from contracting or spreading the disease any further. For more information about the treatment of MRSA, here is Stacy and Jasmine.
Today we're going to be talking about vancomycin, which is the treatment for MRSA. The action of vancomycin is bactericidal, which means it kills the gram-positive bacteria, such as MRSA.
The administration of vancomycin is given orally or is given in an IV. But if given in an IV, it cannot be administered too fast. Otherwise, it will cause red neck syndrome. Red neck syndrome will cause redness on the face, neck, chest, and extremities.
Unfortunately, vancomycin has a lot of side effects and adverse reactions, such as chills, dizziness, fever, rashes, nausea and vomiting, thrombophlebitis, vascular collapse, ototoxicity, nephrotoxicity, eosinophilia, neutropenia, Stevens-Johnson syndrome, severe hypertension, which can put the patient at increased risk for falls, tachycardia, generalized tingling, and cardiac arrest.
The drug interactions for vancomycin include furosemides, aminoglycosides, amphotericin B, colistin, cisplatin, and cyclosporin, which will increase the risk of auto and nephrotoxicity. Dimenhydrinate will mask the symptoms of autotoxicity. Cholestyramine and cholestyramine will decrease the absorption of vancomycin.
When taking vancomycin, the nurse has a few things to consider. First of all, they must obtain a sample and submit it for a culture and sensitivity test. This test is to determine whether the patient has an allergic reaction to vancomycin.
The nurse also needs to consider vital signs in urine output. Also, lab tests such as liver enzyme values, creatinine, and BUN. They will also need CBC with differential.
Lastly, the nurse should tell the patient to take all their medication to prevent drug resistance, and also report any of these side effects and adverse reactions.
Although vancomycin is the antibiotic of choice, here's Taisha with other antibiotic treatments for MRSA.
There are two other medications used to treat MRSA. We have clindamycin, also known as Cleocin. It's like vancomycin because it's bactericidal against gram-positive bacteria. Side effects and adverse reactions of clindamycin may include GI irritation, a rash, colitis, and anaphylactic shock. Clindamycin should not be taken with the following medications: aminophylline, phentoin, barbiturates, and ampicillin. Be sure to take this medication with food to prevent GI irritation, and have epinephrine on hand in case of anaphylactic shock. Lastly, but not least, we have telavantin, also known as Vibativ. It's another option used to treat MRSA. It's a synthetic derivative of vancomycin with the same bactericidal effects. Adverse reactions may include hearing loss, redneck syndrome, and blood dyscrasias. The nurse will be sure to monitor your blood with a CBC differential for possible signs of blood dyscrasias. When given intravenously, be sure to inject the medication slowly to prevent redneck syndrome. And back to you, Jazz.
Thank you, ladies. And just like that, the situation has been neutralized. The students infected with MRSA are now being treated with vancomycin. Well, that's all we have time for in this segment. Thanks for tuning in. See you next week.
Take 697. And cholesterol will.
Hi, my name is Danae Davis, and I'm the nurse working down at the CSU clinic. This is one of our students.
MRSA will cause a severely uncomfortable skin infection. MRSA is a methylene-resistant. Oh my God! What is methylene?
Get the nurse. You better not be recording yet. Are you recording?
Maybe.
Oh, you're already recording?
And that's the new at CSU.